Good morning, everyone, and welcome to the beginning of the 2021 Safety Council, South Metro Regional Chamber of Commerce. And I'd like to introduce Steve Roth, our Bureau of Workers' Compensation representative.
Thank you, Julia. Good morning, everyone. Happy to be with you again for this new year. I have a couple BWC announcements. The Division of Safety and Hygiene has modified the industry-specific safety program, also known as ISSP, for Ohio employers who actively partner with us to reduce the risk of injuries and illness. The overall goal for the ISSP is the identification of risk factors and then the implementation of effective control measures that improve employee safety and health. The following changes went into effect July 1st for private employers and will go into effect January 1st for public employers. Following a DSH safety and health on-site consultation, the employer must now complete follow-up activities before the end of the program year to earn loss prevention activity credit. The follow-up activities include responding to a DSH plan or implementing a post-training survey or completing a post-training survey. Previously, employers completed a post-consultation survey. So this is a change moving into this current year. And then for public employers, the next calendar year. Just a reminder, private employers participating in ISSP for this year that just began July 1st, you must complete the online safety self-assessment no later than July 30th. We've extended the deadline to apply for reimbursements for eligible expenses under our COVID-19 Indoor Air Quality Assistance Program. It's been extended to the end of this year. We also have some information on the drug-free safety program deadline. So private employers participating in the drug-free safety program for the July 1st policy year must submit the online safety self-assessment no later than July 30th. Employers who are taking part of the advanced level, they must also submit the drug-free safety program safety action plan no later than August 30th. So those two forms or two reports are due here coming up the end of this month, and those in the advanced program the end of next month. Moving on, our next topic here, we've enhanced our transitional work grant program for Ohio employers who actively participate in the recovery and return to work of their employees. Employees are now eligible for a transitional work grant every 5 years, and now it's 100% reimbursement from the Bureau up to their approved grant maximum. And that's based on the number of employees that you have in your facility. For those who have a transitional work grant program in place, a transitional work program in place, and you maybe used the grant in the past to get that, now's your chance to update that program to be consistent with the current needs of your facility, the current demands of your tasks. All this information is on our website as far as how the grant program works, the reimbursements amounts, and then you also find the list of providers who will actually put together that program for you. We have just one Division of Safety and Hygiene webinar this month. It's going to be on July 13th, and it's going to be offered in the morning and then again in the afternoon. It's on workers' compensation and how safety affects small business profitability. In the morning, it's going to be done in English, and in the afternoon, it's going to be in Spanish. So that's a unique thing for us. We're going to be delivering that webinar twice in 2 different languages. So pretty exciting about that. That's July 13th. Our speaker this morning is Tina Rezash-Rogel. Tina is the Marketing and Communication Manager at OneFifteen. In this role, Tina shares the stories of OneFifteen with the media and community groups. She is actively involved in the Dayton community, serving terms on Artemis Board, the Board of Directors for the South Metro Regional Chamber of Commerce, and the Board of the Dayton Chapter of the American Advertising Federation. Tina has a deep passion for children who come from hard places and is pleased to be part of the team at OneFifteen to help heal Miami Valley families hurting from substance use disorders. Today, Tina will share the challenges of fighting a drug epidemic inside a COVID-19 pandemic. Please join me in welcoming Tina.
Hi, everyone. Thank you so much for joining us today. It's really an honor and a privilege to be here with you today. I have the best job in the whole world. I get to tell people like you about OneFifteen and it's really a privilege to be able to do that. OneFifteen came to Dayton. Well, the announcement was made in February 2019 that OneFifteen was coming to Dayton. And there's been a lot of excitement about it, a lot of curiosity about it. So I'm really happy to be here and share what we're doing in our community. So people living with opioid addiction are dying from unintended overdoses at an alarming rate. And we at OneFifteen, we are on a quest to reverse that course. So if you lived in Dayton in 2017, you remember it was a really tough time for us here in the Dayton community, but not just for us. Nationally, our country was being gripped by this opioid epidemic. So in 2017, 115 people a day were dying of unintended overdose across the United States. If you were here in Dayton, you remember it was a very dark time for us. In fact, we were named ground zero for the opioid epidemic in Montgomery County, with more people dying per capita from opioid overdose than anywhere else in the country. It was a very, very sad time for us. So we named OneFifteen because we were hoping that would be the worst it would ever be. And in honor of those people, the numbers are actually inching upward. So we've got a lot of work to do to bring the numbers back down again. OneFifteen is a not-for-profit healthcare ecosystem dedicated to the full and sustained recovery of people living with addiction. We're going to talk about this a little bit more as we move on, but the not-for-profit portion is the portion I really want you to focus on. We're going to talk about that, why that's really important in our community. Our mission is healing people experiencing substance use disorder through learning, science, and partnership. And our vision is to lead a movement that gives people hope for today and offers communities a better tomorrow. We are in partnership with many, many organizations in the Dayton community. We have 4 founding partners. Both of the healthcare systems, Kettering Health and Premier Health, are founding partners. Verily, which we're going to talk about in a little bit, so I'm not going to spend a lot of time on that right now. But the reason why I want to mention Verily is when the announcement was made in February 2019, the headlines in the papers and on television were that Google was coming to Dayton. Google did not come to Dayton, but Verily is a sister company to Google. And we're going to talk about why that's important here in a minute. And then Alexandria Real Estate Equities is a founding partner. They built our campus. We have a 4.5-acre campus in the Carillon neighborhood of Dayton. And then the Adamus Board, the Montgomery County Adamus Board, is a huge partner with OneFifteen in terms of funding the programming that we're doing and the services that we're providing in the community. We won't go one by one through the rest of our community partners, but I do really want to point out that the Carillon Edgemont neighborhood associations are wonderful partners with us. We are located in the Carillon neighborhood, and we work very hard to be great neighbors with the folks that live around our campus, and we're super grateful for their support. So we'll talk just for a minute about OneFifteen and the fact that we are an MSO, a management services organization, which means we partner with clinical partners, operating partners to deliver the clinical services to our patients. So Samaritan Behavioral Health is the operating partner for 3 of our levels of service: our Outpatient Clinic, the Crisis Stabilization Unit, and the Inpatient Residential Treatment Center. SBHI is a name that many of you might be familiar with. SBHI has been providing mental health and substance use disorder treatment services in the Dayton area for more than 50 years. They are a division of Premier Health. Their mission is to provide mental health and addiction services that touch, teach, and heal. And their vision is where help for life's challenges is readily sought and compassionately given. So once our campus is fully operational, we'll talk about the timeline, SBHI will add 92 jobs to the Dayton region, which is very exciting for us in the healthcare sector. So if you've been by our campus, you'll notice there's a 3-story brand new construction building. That's called OneFifteen Living. That's low intensity residential treatment. And RI International is the operating partner providing the clinical services in OneFifteen living. RI International is a global organization, and they provide substance use disorder treatment, housing, outpatient, inpatient, all across the country, and including Australia and New Zealand. So we're really excited to partner with them in this regard. This is the first time they're coming to Dayton, and we think they're going to bring lots of new innovative thinking and care models to partner with us. When they're done with all their hiring, they will add 20 jobs to the Dayton market. So we're looking at about 110 new jobs added because OneFifteen is coming to Dayton. So you can see there that we are in direct partnership with Samaritan Behavioral Health and RI International. So what is an MSO that I recently referred to? An MSO is an entity that provides administrative and management services to another organization. And in this case, that's SBHI and RI International as our operating partners. And they are providing the direct clinical care for our patients across the OneFifteen ecosystem. So here's our campus. I love this picture for lots of different reasons. You can see that 3-story building on the left side. That's OneFifteen living. The building on the bottom right-hand corner is our outpatient clinic. And that curvy path you see, we call that our path of recovery. A recovery journey has really no beginning and no end. And so we like that path to kind of symbolize what a recovery journey might look like, with lots of twists and turns. But it's just a beautiful campus, and that's beautiful imagery of what that recovery journey might look like. The RTA bus is just kind of a bonus that it's there, but we're super grateful to the RTA for putting a bus stop right outside our outpatient clinic, removing transportation as a barrier to any folks that want to get to our campus. This is another little bird's eye view. We are now, as of June 1st, so just a little over a month ago, now providing our full continuum of care on our campus, and that includes a crisis stabilization unit, an inpatient residential treatment center, our outpatient clinic, low-intensity residential treatment, which is that OneFifteen building you're looking at, and then we operate a MAT clinic on our campus as well, which we'll talk about here in a minute. So let's start with our outpatient clinic. That is that building you saw on the bottom right. We provide lots of medical services here. Our MAT clinic is located in this building, where we provide our patients with Vivitrol, Sublocade, any kind of medications that are FDA approved and proven to help folks in a recovery journey. We offer our psychotherapy services here, individual and group therapy treatment. We provide assessments here, support services. We have a care coordination model that includes a care coordinator and a peer support specialist being assigned to each one of our patients. Recovery is a tough journey, and we want to make sure that our patients are supported with everything that they need, not just individual or group therapy, but all the other social determinants of health that go along with recovery. And that's what that care team provides. We offer a family wait area in our outpatient clinic, so patients who have little ones, and we don't want childcare to be a barrier for them either. They can bring their little ones right to our campus and they'll be cared for while they're attending to their services and focusing on their recovery. So that is our outpatient clinic, and that was the first level of treatment that opened. We opened the outpatient clinic in October of 2019. The crisis stabilization unit you didn't see on those pictures because the crisis stabilization unit is actually located just a very short distance, 1 block away, in Kindred Hospital. And if you drive down Edwin C. Moses from Welcome Stadium, UD Arena, and you pass the Montgomery County Job Center, you'll see Kindred Hospital right there on your left. Our crisis stabilization unit is located in the old emergency department of the Dayton Heart Hospital, which is what it was prior to being Kindred Hospital. What the crisis stabilization unit does is folks who are in active withdrawal, who make the decision that they want treatment, this is a place that they can go, or their family members or friends can bring them, instead of a hospital emergency department, where they can receive very specialized treatment services for whatever it is they're going through at the time. Inside the crisis stabilization unit, we offer a 24/7 hotline to care that anybody can call that number 24/7. and determine if they need to come into the crisis stabilization unit, or maybe they can come into the outpatient center the next day. It just kind of depends. So we love that that's available to anybody who wants to talk to somebody about receiving services. We do offer MAT services as well in the crisis stabilization unit. Our physicians are on hand to provide the initial evaluation. And then, of course, we offer the Vivitrol and Sublocade there as well. We will triage. We do have the call center there, and we can offer diagnostic assessment and treatment planning from the CSU to determine what level of treatment someone might need across our campus. And then, of course, we have the supportive services there inside the CSU as well. CSU Crisis Stabilization Unit. Sorry, I should have told you what that means. Okay, and then moving on to the Inpatient Residential Treatment Center. That's on the 3rd floor of Kindred Hospital. We have 32 beds available, but right now we're kind of starting slowly to make sure that we can operate this level of service safely in a COVID environment for our patients and our staff. So right now we only have 8 beds open of the 32, but we hope to have the 32 open soon. So what does the Inpatient Residential Treatment Center do? Clinical management will medically stabilize people. The first 5 days might be when someone is in active withdrawal and they really need that 24/7 medically managed withdrawal services. And that's really a critical time for someone in those first 3 to 5 days going through withdrawal. Then they'll segue into our clinically managed stabilization program, where for 20 days, maybe average length of stay would be 20 days, they will participate in, again, group and individual therapy to help them get back on their feet. And then we'll surround them as well with the care coordination and peer support services and begin the skill building process. This is where someone might participate in some workforce development. Do they need some additional training? Do we need to help them write a resume? We really want to make sure that our patients have the opportunity to start rebuilding their lives right away so that they can live in a fully sustained life for the rest of their lives. So patients will stay overnight here, and we will provide lots of programming to them. Of course, they'll get their 3 meals a day, and we'll provide exercise opportunities and all that kind of good stuff that goes in recovery. All of those services that I talked about, again, Samaritan Behavioral Health, SBHI, is the operating partner for those services. Now we segue into OneFifteen Living, where RI International is the operating partner. We have 58 beds here, 29 rooms that are double occupancy. We're going to slow roll here as well. We opened OneFifteen Living. This is the last level of service that opened on June 1. We will be adding as we go. I think it will be a matter of several months before we're at 58, just to make sure, again, that we can do this safely in a COVID environment. Our residents here will participate in therapy, recovery skills, relapse prevention, coping skills. They will continue their medication-assisted treatment in the MAT clinic over in the outpatient clinic. And we will really work with them to reintegrate them back into work, school, their family environment, and then we will build their skills as well. We've got exercise room, meditation rooms. We have a beautiful campus. You saw the path of recovery. We really want to provide them with this beautiful space where they can continue their recovery journey. So what does the clinical model look like for us? This is an interesting statistic. It's a sad statistic. 1 in 10 people who need help, who are addicted to a substance, will reach out for that help. So right off the bat, we're behind the 8 ball in the numbers. So when we get somebody into treatment, it's really important that they stay there. So what the research was showing is that anytime there's a break in care, if someone was leaving a hospital emergency department, going into inpatient, then going into outpatient services, every time there was a break in care, 50% of the people would not move on with their care. So what OneFifteen is trying to create is a model of care where all levels of service are provided on one campus. There's never a break in care. what we're setting out to prove is that is the best model to keep people in treatment longer so they have better outcomes. So we really want to improve our patient engagement. We want to see a success model that works with this. We're watching the care coordination model very carefully as well, again, surrounding our patients with all of these services and marking to see if this keeps them in care longer as well. Of course, the MAT treatment that they're receiving, and then the technology tools and solutions that we're creating. Verily is helping us with that. Verily is a health tech company, so they created our telehealth platform that we can provide services to our patients via telehealth. And so we're grateful to have that. Verily also has created a patient app for us, which is improving patient communication with their care coordinators and their clinicians. So our folks can reach out to us 24/7, anytime, day or night, and talk to somebody if they're having a craving or just need a little bit of additional help. So when we look at our patients, we really want to take a holistic approach. We know there are so many social determinants of health that go into why someone might have a substance use disorder. Maybe they're experiencing homelessness. Maybe they've experienced trauma in the past. So when we look at the whole person and everything that we need to do to surround them with services, you can see this list. This is just a very partial list of some of the things that we're going to be working with our patients. You know, some of our folks might come to us and need additional education. Maybe they never received a high school diploma, so we will offer opportunities for them to get a GED. We want to surround our folks with anything that they need to put them on a path of sustainable recovery. So what does that look like? This is the timeline. And so we kind of talked through that. So the the outpatient clinic opened in September, October of 2019. The crisis stabilization unit opened in February of 2020. Now you can do the math. The stay-at-home order happened March 23rd in the state of Ohio. And so we only had a few weeks to get the crisis stabilization unit up and running before we were on a lockdown, which is why being able to make that adjustment and that pivot, I know people don't really like that word anymore, but the pivot to telehealth was so critical that Verily had developed that telehealth platform for us. And we were able to provide consistent services to our folks via telehealth throughout the pandemic. And you can kind of just see the timeline there. I don't want to spend a lot of time on that because I look at the clock. I need to move it a little bit. So, okay, here we go. So what makes us different? We talked about the full continuum of care. So while most services are now offered in person because the numbers of people getting COVID-19 are going down, we feel like we've learned so much throughout the pandemic in terms of how to keep our patients and our staff safe. So while most services are now offered in person, we want to continue to offer telehealth. So some of the things that we cannot offer via telehealth include the injections. We need somebody to come in, and then the residential levels of care. Of course, we need to have people on our campus for that as well. So let's take a look at what we have now open. So you can see we've got the crisis stabilization unit open, inpatient withdrawal management and inpatient residential treatment, our outpatient services, the care coordination services, low intensity residential treatment, which is OneFifteen living, and all of our wraparound services. This is our full continuum of care. This is what the OneFifteen ecosystem currently looks like. So we talked briefly about that care coordination model. What does that really mean? We want to make sure that each of our patients has a therapist, has a team of support people, that we can provide resources to our folks. If they are involved in the criminal justice system, we want to provide them with people that can help them maneuver through that system. We want every patient to get what they need and put them on an individual plan of treatment. So what does that mean? We want to engage patients during their transitions of care and make sure that we don't see that 50% dropout rate. So they will see the same care coordinators, same peer support specialists, because these people develop relationships and trust with the people that are helping them on their recovery journey. We want them to be able to see them through the whole thing. Some of our care coordinators actually do aftercare and go out and meet with patients in their home, make sure that they have what they need at home. Do they need food? Do they need clothing? What is it that they need? We're going to work with them to get that. And then we will communicate with our patients. We talked about this via text, email, phone, and now the patient app, which is another extremely efficient way for our folks to communicate with our patients. And we definitely will follow up about any missed appointments and make sure that there are no barriers to care, be it transportation, childcare, what other barriers to coming in for their appointments, and then we're going to work very hard on removing those barriers. Okay, so let's talk about Verily right now. So again, in February 2019, when everybody thought Google was coming to town, it really wasn't Google. Google is an alphabet company. Verily is an alphabet company. So they are sister companies to each other. But why that's important is OneFifteen is a standalone 501c3. We are a nonprofit organization, and we are charged with making sure we can run an efficient model and fund this efficient model, which is why we have those partners, the founding partners we talked about at the beginning. So Verily will power our learning health system. And so what that means is we're going to look at the health data. Our patients have consented to us collecting their health data, and we remind them on a regular basis that we're collecting their data and they can opt out at any time. Verily is doing the support work for us by looking at that data, creating a quality metrics dashboard so we can make sure that we are providing the absolute gold standard of care for our patients. They will look at the data, they will analyze the data, interpret the data, and then provide tech-based care solutions based on what we're finding in that data. Again, the patient app is the best example of that currently. So what is a learning health system? We talked about how we are collecting data from our patients, but we need to look at that data and analyze it. We need to implement it, evaluate, adjust, and design programs that are based on the data, based in evidence. This is so important because right now there's not a lot of data surrounding addiction medicine. So this is one of our biggest goals, is to create the data and analyze it, learn from it, make the necessary adjustments so we can really create a gold standard of care here in Dayton. Everybody watching this probably knows that Dayton is the birthplace of innovation as much as it's the birthplace of aviation. And so we really want to create innovative solutions here in Dayton, and we're just so grateful that Verily chose Dayton as the location to build this learning health system. So what have we accomplished so far? A lot of people ask us about the numbers, and as I'm looking at this, it's outdated already. We are nearing 3,500 patients in our ecosystem. And why is this important? When we set out in October of 2019, we were hoping that we would be able to provide treatment services to 1,000 people per year. We treated our 1,000th patient 7 months in to this journey. And if you do simple math, we've been open about 20 months now. If we are treating 3,500 patients at this point in time, it's about double what we had anticipated. So challenges have come along with that, of course, but we are trying to address those challenges daily, staff being one of them. We're constantly hiring. If you go to OneFifteen.org and scroll all the way down at the bottom, there are some links. If anyone is interested in joining our team and coming to work with us, that would be amazing. So when we look at the breakdown of our patients, 52% are male, 48% are female. I think that number is important because I think there's a preconceived notion that there are more men than women struggling with substance use disorder. Our numbers are showing it's pretty close. 39% of our patients are from the minority population. 39% of them also are self-referrals. They walk into the doors themselves, or they call our 24/7 access to care line themselves. They know they need help and they're reaching out for help, and we're grateful to be there for them. 34% are referrals from the criminal justice system. 19% are referrals from social programs. And as we look at the substances that our folks are struggling with, this might surprise you as well. 27% cannabis, marijuana, 25% opioids, and 23% are struggling with alcohol. Many of you probably saw the headlines and read the numbers that alcohol consumption skyrocketed in 2020. When people were staying at home, it was a very difficult time for everybody, and we really saw a sharp increase in alcohol consumption. So where are we heading next? Here's our capacity where we can be. This is not where we currently are. So let's just talk about this for a minute. We can take 12 people at a time in the crisis stabilization unit, and there are times that the crisis stabilization unit is full. We talked about how we have 32 beds in the inpatient residential treatment center. Right now, we have 8 open, but we do plan to open more soon. OneFifteen Living, I do believe there's 8, maybe 10 living in OneFifteen Living currently. When we're at full capacity, we will have room for 58. So you can imagine, I mean, add up the numbers. And then on top of it, the hundreds of people who are coming through the outpatient clinic. Our campus is busy. We have a lot of people, a lot of activity on our campus. Also launching telehubs is definitely on our radar in the future. We recently put a telehub in the Monday Community Correctional Institute. We know folks who are incarcerated, a certain percentage are struggling with substance use disorder, and we feel like the sooner we can get to those folks to provide treatment options, the better. So we have a telehub at Monday currently. We have telehubs currently inside Miami Valley Hospital and Kettering Hospital, again with the purpose of if folks come into the ED but they really need this specialized treatment for substance use disorder, we want to be able to be there for them as well and provide that support in our local hospitals. And that number is going to grow from there as we continue adding telehubs. We want to share our learning. Again, we're a learning health system. We're learning every day. And so we will write white papers and research papers and share everything that we're learning. We're not doing this to do this and keep all the information right here in Dayton, Ohio. We're learning and doing all of this to do this and share with everyone who wants to do better and learn more when it comes to the gold standard of care in substance use disorder. We're developing new technologies to enhance our patient care. We talked about the patient app. Improvements are being made to it daily, and there will be some new technologies rolling out in the next 12 months as well. So how do you follow us? How do you learn more about us? I always love to refer people to OneFifteen.org, our website. And again, if you scroll all the way down, you'll see 3 links if you're interested in learning about the job opportunities we have across our campus. We would love you to share them with folks that you think might be interested in joining us as well. We do have a LinkedIn page. It's just OneFifteen on LinkedIn, and I would ask you to follow us. Any kind of important updates, new research, new learnings, community events that we're involved in, we post about that on our LinkedIn page, and we would love you to follow us on LinkedIn. And what I'd really love you to do is follow us on YouTube. When COVID hit, and we couldn't bring people onto our campus for tours and show off our beautiful campus and our beautiful buildings, we invested in virtual tours, video tours, working with NAC Creative here in Dayton. We took our COO and our Director of Nursing, and they toured all of our levels of care. So I would love you to go and look at those videos, see inside our building, see what we're trying to do here on campus. And in September of 2020, when we did a ribbon cutting for OneFifteen Living that you see there on the screen, we had some community VIPs come out, and we have their speeches on that YouTube channel as well. And I'd love you to hear from Senator Rob Portman, Congressman Mike Turner, the president of the Carolyn Civic Council, Gwen Buchanan, the executive director of the Adamus Board, Helen Jones-Kelly. I'd love you to hear from them on why it's important that OneFifteen is in Dayton and what that means to our community, because it's really such a privilege. It's such an honor and privilege for us to have OneFifteen in our community, and I'd love you to know all about that too. I'm going to give you my email address. My email address is trnc at OneFifteen, all spelled out, .org. And I would be happy to take any questions via email that you have. It has been an honor and a privilege to be here with you today. I'm really excited. This is the best part of my job, getting to brag about all the good work that's happening. Oh, I will share one more thing. If you go to the website, OneFifteen.org, and click on the News tab, very recently we posted some patient stories. Another excellent part of my job is I get to talk to our patients and share their stories. And I think you will find they're quite inspirational. Our patients are so courageous and so brave, and then to share their journeys to help others is just a whole nother level of courageous. And so I'd love you to go to our website and read their patient stories, and you'll see our annual report on that news tab. And then the media has been very, very kind to us and done lots of news stories on us that are on that news tab as well. So email me with questions. Thank you, everybody. I'm really grateful to be here, and I hope you have a wonderful day.